but I would love to know more about that. There was injunctions ordering that they be given vaccines. I don't know what that's about.
Dude, do your fucking research. This is unbelievable. Unfucking believable. And you have a wife who speaks Spanish. You can read the Mexican press if there is no information in English. This is just this. If you take away anything from this video, just take away the absolute shit research abilities of this man.
When the operation of the machine becomes so odious, makes you so sick at heart that you can't take part. You can't even passively take part.
It is rare that Mexican policy is discussed among the online left, so I was rather pleasantly surprised that my bête noire, Jimmy Dore, decided to speak about it. Basically, he made a video. His most recent one right now is about Mexico's refusal to vaccinate children. Now, let's understand why Jimmy Dore is doing this. Jimmy Dore obviously is an anti-vaxxer. I think that is, that is settled at this point, even though he will not admit it. So what he's doing is he's finding basically any topic that can seem controversial related to vaccines and just pushing it and pushing it and pushing it. And the current talking point the two current talking points are mandates and vaccination of children. So what he's doing here is he's going to look at some other country that, say, opposes vaccination of children, and then use that as proof that that's the correct policy that the US should implement. So here's his video. He will discuss some of the comments, some rather unfortunate comments made by Mexico's health secretary, Jorge Alcocer, a name which, by the way, Jimmy Dore will struggle to pronounce throughout this video. But let's watch the video. I'm gonna tell you exactly what's wrong in what he's saying, and also shed light in exactly how Mexican COVID policy is generated, and what are the causes of this policy, which quite frankly has been one of the worst in Latin America. So let's watch.
So guess we've been talking a lot about child vaccines, and the risk for a child from COVID is less than the risk from flu. Just so you know, that's a fact.
So the first lie doesn't even, not even 5 seconds. That is a lie. There was a study made by the CDC in June that showed cumulative COVID-19 associated hospitalization rates during October 1 to April 24 were 2.5 to 3 times higher than were influenza-associated hospitalization rates from 3 recent influenza seasons, obtained from the Influenza Hospitalization Surveillance Network. The reason why they're comparing these numbers with previous flu seasons is because the flu season in 2020-21 was incredibly mild. And I made a video about this a while back, where I showed that COVID was over 500 times more deadly than the flu. So I'm going to link to that at the end. But yeah, that is factually wrong.
And that's a fact. Okay. And so now, no matter what you see on NBC News or CNBC or MSNBC or CNN or Fox News or ABC News, or read in the New York Times or the Washington Post, your child is not at risk from COVID. Don't let.
Define risk. Are some children at risk? We don't know if they're going to die or not? Probably. I'm going to talk a bit more about this later, because I'm actually not entirely convinced that vaccinating, especially very young children, is necessary. Not that it's bad, that it might not be necessary, but let's keep watching this.
Them scare the shit out of you, because they're doing that because they're funded by Big Pharma. And nobody else on the left is willing to say this, but that's what's happening. And now the health minister from Mexico is saying don't vaccinate children unless they have a comorbidity. So this says health minister insists vaccination not beneficial for children. That's from Mexico News Daily. By the way, that guy, doesn't he look like Martin Scorsese's mom a little? Right? Maybe.
I think that is like the standard quality of Jimmy Dore jokes when he's doing his stand-up tours. In other words, bad.
Maybe with a touch of Estelle Getty. I don't know who that. I don't know who that is. All right, here we go. Health Minister Jorge Alcocer. Oh, how do you pronounce that?
Alcocer.
Alcocer. Okay, there you go. Coming right from 100% Mexican.
Okay, so when I saw this video, I was a bit embarrassed at the fact that his wife and producer is Mexican. Well, probably Mexican American. Trust me, that stupidity does not run in our DNA naturally. I can guarantee you that.
Health Minister Jorge Alcocer has once again claimed that COVID-19 vaccines could inhibit the development of children's immune systems. Now,
Okay, I'll leave you a couple of seconds to think about how stupid that statement is. And by the way, I'm not defending Alcocer. I think he's an idiot. So what is so stupid about that statement? I'll give you a hint. When is the period of your life where you get most of your vaccines? Is it adulthood? Is it adolescence? No, it's as a child. As a child is when you get all those vaccines. And does that interrupt inhibit their immune systems? Of course it doesn't. So this is an objectively stupid statement.
I have to say, according to you, I am not a doctor. I'm a fucking jagoff comedian who smokes pot.
So why are you doing all those COVID videos? See how I hate when he does this, because he always claims like, oh, I'm not gonna opine about highly technical health related issues because I'm a jagoff comedian. So I'll just let these other experts with dubious credentials say what they have to say. And again, there are a lot of idiots in Mexico's cabinet. Okay, he's making it seem like somehow only the U.S. will have idiots in government. Rest assured, Mexico has a ton of idiots in its cabinet.
And I do not give out health. What do you call it? What do you call it? Advice.
Yes, you do.
I don't. That's not what this is. This is a news information. This is for information purposes. This happened. We're not advocating or not advocating.
What is this happened? No. What happened is he said this, which is stupid. That doesn't mean that statement is true. It is true that he said that statement. Seriously, how stupid are his fans that will now take this as a fact? I repeat, what's the only truth in that statement is that he said this, not that it's true.
He says, this is what this guy says, and we're reporting it because he's the health minister of Mexico. Health Minister Jorge oh God, I can't do it again. Has once again claimed that COVID-19 vaccines could inhibit the development of children's immune systems. That's what this guy said.
Okay, so could means we don't know. So where's the study that proves this? Is Jimmy Dore going to show it? No, because there isn't one.
Boy, that children have that sounds like more than a passing side effect. Anyway, children have a wonderful immune system compared to the later phases of their life, he said during an appearance in the lower house of Congress. Okay. He sounds way too humane to be. It sounds like a quack. In that context, hindering the learning of a child's immune system, the cells that defend us our whole lives, with a completely inorganic structure such as a vaccine is not the right thing to do.
Again, this statement is objectively stupid because as a child is when you get most of your vaccines in your lifetime. So funny how he's now concerned about the impact of this particular vaccine on children's immune systems and not all the other vaccines that you get as a child. This is stupid. Absolutely stupid. But of course, it fits into the Jimmy Dore narrative. Now, I'm going to explain later on why I think he says this, because I don't fundamentally think that Alcocer is anti-vax. I'll give you the reason why. But let's keep watching.
The health minister said. That's what he said. That's what the health minister. Wow, he doesn't support a completely inorganic structure? What is this guy doing in government? Are you kidding me? Here we go. How do you say his name?
Alcocer.
Alcocer made the remarks a week and a half after claiming that vaccinating children against COVID-19 could have a limiting effect on the development.
Again, could. Where's the data? Where's the study? Jimmy Dore, if you wanted to back this up, you could have found a study that proved this and then showed that study on your show. Because clearly when there is a non-peer reviewed study from Bangladesh that proves horse dewormer works, you are showing that. So where's your research? Or was your fired producer the one who did your research?
Of their immune system. He said Tuesday that he wouldn't vaccinate his grandchildren. This is the health minister from Mexico. Health regulator, how do you say that? COFEPRIS has approved the use of the Pfizer vaccine to inoculate youths 12 to 17, but the federal government hasn't made the shot widely available to minors and hasn't indicated that it will do so. However, it has begun inoculating adolescents with underlying health conditions, which that makes sense, that place them at risk of serious COVID-19 illness, and vaccinated minors who obtained injunctions ordering they be given shots. I don't know what the hell that's about.
Why didn't you do the research? You could have Googled this. I'm going to explain this at the end because it is important. But you didn't do your research. You made a video on a country that you don't know, whose names you can't even pronounce, and you're using that as a fact and using that as a statement of how U.S. policy should be modeled on. But you didn't do your goddamn research on what exactly the controversy about this is.
But I would love to know more about that. There was injunctions ordering that they be given vaccines. I don't know what that's about.
Dude, do your fucking research. This is unbelievable. Unfucking believable. And you have a wife who speaks Spanish. You can read the Mexican press if there is no information in English. This is just this. If you take away anything from this video, just take away the absolute shit research abilities of this man. And yet, he has almost 1 million people on YouTube following his bullshit. Unbelievable.
But that's interesting. So there you go. Take it case by case, not treating all bodies as if everyone is exactly the same. If you have an underlying comorbidity, you should probably consider vaccination according to the science. Don't go according to.
That's not the science. That's the statement of one guy, an objectively stupid and factually inaccurate statement. That's not the science, just because a scientist says so. By his own logic, anything that Fauci says must be true, because Fauci is also a doctor. Why isn't anything Fauci says true by this same standard? No, we're going to go to a different country and believe a guy whose name I can't pronounce. Jesus Christ.
A jagoff comedian. Go according to the science. So that's super interesting, especially when the propaganda in the United States through the establishment, big pharma funded media is ramping up like crazy.
Oh yeah, the Mexican media is not biased at all. At all. Give me a break. Again, he doesn't know Mexico, but give me a break. Big Pharma has no presence in Mexico whatsoever, I'm sure. Come on.
To make you afraid that your kid's going to get super sick from COVID. And children have such a low chance of getting seriously ill from COVID that it's hard to measure. They have a bigger risk of serious illness and dying from the flu
Again,
than from
untrue.
COVID. That's all you need. Do you need to know more than that? Do I need to get more graphics and show you? Do I have to have a video play? Is that enough? That's a fact.
Well, you kind of should show the studies that you are claiming these facts are coming from. That would be nice. Because again, if you're not showing any evidence, then we have to take the word of this jagoff comedian.
Okay. And that guy says, well, you heard what he said. So that's interesting.
Again, we have to believe a jagoff comedian who is quoting an unsourced statement by a public official, similar to Fauci. So all those months priming his audience to disbelieve everything that comes out of Fauci's mouth, but we're just gonna believe the Faucis in other countries.
I know this is not going to be covered by the mainstream press in the United States. So that's why we're here, because we're an alternative news show. So
yeah, alt-left, as in leftist who are really right-wing. That's what you are, Jimmy. Alt-left.
we're going to give you the alternative view from the establishment. The establishment said, Big Bird and everybody says kids should get vaccinated. That's the establishment view. And that's garbage. If you think you should vaccinate someone who has less of a chance of serious illness from COVID than they do from the flu, that doesn't sound like logic.
All right, so that is the video part. Now I'm going to show you the what Mexico's COVID policy really is about and why the reasons they don't want to vaccinate children. And it's not because they're anti-vax. There's another reason for that. So first I'm going to talk a bit about the injunction that he mentioned. The injunction was made by a federal court less than a month ago. It was a federal court that basically ordered the government to start vaccinating children from 12 to 17. And what the government did, because it insists on it not wanting to vaccinate children, is that it made an appeal. So I will translate these articles. Salud, which is the health ministry or health secretariat, appeals a resolution that obligates, that forces vaccination to minors of 12 to 17 years. Now, when it says, I want to be clear what it means here by obligating or forcing. It doesn't mean that you are forced to get vaccinated. What it means here is the government is forced to offer the vaccines. Right now, vaccines in Mexico are being administered exclusively by the federal government as part of its vaccination program. And it's based around age and location. So whenever your municipality or borough is up for vaccination, you will be notified and you have to go to a vaccination center and get your shot. And then it moves to the next municipality and so on and so on. So that's the vaccination program. It's not like you go to your doctor and you get it there whenever you want to. So that is what it means. It means that the federal government needs to start, setting a timetable for vaccinating people in this age group. It is not mandatory. There are no vaccine mandates in Mexico. If you don't want to get vaccinated, you are fine. Mexico has slightly stricter rules, usually enforced by private companies, when it comes to face masks and things like that. Almost every establishment in Mexico will force you to use a face mask and to use gel on your hands when you go in. But there is no vaccine mandate at all in Mexico. So yeah, that is basically the story of this resolution. Now, obviously, when this court made this resolution, the health ministry decided to make an appeal against it because, like I said, the government does not want to vaccinate children, and I'm going to explain why. This is going to be the climax of this video. And currently, this part, what he mentioned, is true. The only people between the only children currently being vaccinated in Mexico are children that have comorbidities. Those are the only ones who are being given the vaccine. And even then, it took a while before they started offering this. Now, the other implication that Jimmy Dore makes, and again, this is rooted in his utter lack of knowledge of Mexican healthcare policy and his lack of research skills in finding out who is in charge of what. Alcocer is not the person in charge of COVID policy. The person in charge of COVID policy is an undersecretary of the Ministry of Health called Hugo López Gatell, which is the guy who you see here. He is basically Mexico's Fauci. Now, the implication that Alcocer is setting, the standards of health policy would be similar to saying that the US Secretary of Health is the guy who is running the show, not Fauci. So let's make it clear. He is not in charge of COVID policy. Hugo López Gatell is. And behind Hugo Gatell is the president, López Obrador. So those are the two people who are really in charge of the COVID response. Now, this clip is from this morning, because López Obrador has a morning press conference every single day. It's ridiculous. It's a waste of time. But this is from this morning, which Gatell appeared, giving a lot of the same arguments that Jimmy Dore is repeating, but he makes a concession towards the end. And I'm going to show you this. I'm going to translate what he's saying.
Muy distinto a las personas adultas mayores que afortunadamente han sido ya vacunadas. Termino comentando cuál va a ser el mecanismo. Es el mecanismo por el que hemos incorporado a todas las demás condiciones de riesgo.
So he's saying that there's going to be a change in the mechanism of vaccination. That is, certain other people are going to be incorporated to the vaccination program.
Primero adultos mayores o personal de salud, adultos mayores. También incorporamos a las mujeres embarazadas en mayo pasado y ahora.
So he's saying they've incorporated older people, women with pregnant women.
Incorporaríamos a niñas, niños de 15 a 17 años que no tengan comorbilidades.
So what he said there is that now they're incorporating, I think for the other groups that I just mentioned, I think that those might be booster shots. I'm not quite sure. But what he's mentioning here is that now they're going to offer it to teens, basically teens of 15 to 17 that don't have comorbidities. So there's been a concession there by the government on offering vaccination to children. Now, again, back to the issue. Why are they refusing to vaccinate children? It's not because they're anti-vax. It's because they're stingy. The real reason that Mexico has done such a poor job at the pandemic handling has been because the government is committed to fiscal austerity. Now, I know this might sound really shocking to any American or Westerner watching this video that thinks Mexico is a leftist government, when in fact, in practice, it isn't. Okay? And I've mentioned this many, many times on my Twitter account. You can see my comments I make on Mexican policy there. The López Obrador government has followed probably the most economically right-wing policy possible since its very start, and that is fiscal austerity. This government has basically been stingy as fuck, and it has tried to avoid any form of COVID-related spending that it could. There is a study made by the IMF on what every country in the world has spent on COVID during the pandemic. That is direct spending, like income support, things like that. Mexico is one of the countries in Latin America, if not the world, that had the lowest spending relative to GDP, something like 0.7% of direct spending. Whereas other countries in Latin America, even poorer countries than Mexico, like Peru, spent something like 8% of GDP. Argentina as well, Brazil spent more than 10% of GDP, Chile as well. So Mexico did not offer any sort of income support to workers who were laid off, no support for small businesses who had to close during the first lockdown, absolutely nothing. This is, I repeat, a left-wing government that is pursuing fiscal austerity. Another example of this austerity has been how little Mexico has spent on testing. And I think that is the best evidence in terms of COVID itself. Now, here is, from the Worldometer's site, which I really like. That is Mexico. Mexico is the fourth country with most COVID deaths in the world, and also pretty high in terms of deaths per head. But here's the shocking statistic. Here's the number of tests that Mexico has undertaken per million population. So 88,000 versus 300,000 in Brazil, a country that is very similar to Mexico in terms of income and socioeconomic development. So Brazil has spent over 3 times more than Mexico on testing. Peru, a country that is considerably poorer than Mexico, has spent 500,000 tests per million population. So check the difference. Again, Peru, despite being poorer than Mexico, has somehow managed to spend enough to cover its people and cover its COVID needs. We can go on. Colombia, also poorer than Mexico, has also similar levels to Peru. Argentina, slightly wealthier than Mexico, but also similar number to Colombia. And yeah, we can go on and see any other. Chile, admittedly wealthier than Mexico, but that's almost first world levels of COVID testing per capita. Almost similar to Spain. So you see the picture. And in even like really poor country like Bolivia, for Christ's sake, Bolivia, way poorer than Mexico. 215,000. So that is absolutely shameful. And again, we can look at other numbers like actual spending, etc., and see that the government has really refused to spend as much as it could. Now, on the issue of vaccination, Mexico has been doing okay. To quote Chernobyl, not great, not terrible. It has, I didn't put the map up, I'm too lazy to do it now, but it's lagging countries like Brazil, Argentina, and others. They have a significant amount of the adult population now at least partly vaccinated, so that is good. They did spend initially on a good stock of vaccines, which is good. So they did see at least the urgency of let's spend on the vaccines to to avoid spending on other things. So I think that is the reason why they did it. Even so, they've been pretty stingy with the vaccines because they are still hoarding quite a number of them. This is sorry, not that one. This is recent. This is from just a couple of days ago. Here's the number of vaccines that have been received. That have been applied. So Mexico has applied nearly 130 million vaccine doses so far. And here's how many vaccines have been received. That's how many received. 65 million. So we're talking about 35 million vaccines that are sitting around there in a warehouse somewhere. Now, obviously, these numbers should not match. Obviously, the moment that a vaccine lands in the airport and gets administered, especially in like a rural area of Mexico where transportation is not that great, it's going to take days or weeks, maybe even months. But this is still a huge amount of vaccines that we have in reserve that we're not using. Now, I don't know why that stock is so big. I don't know if they are... Oh, they're also not planning any booster shots yet. So I don't know what they're doing with this. Like, we would have the capacity to vaccinate young people, or at least start vaccinating with the vaccines that we have now. But I repeat, the real reason that the Mexican government does not want to vaccinate its children is not because they're anti-vax. It's because they're stingy. But of course, Jimmy Dore will use that as an excuse to promote his anti-vax views. And a reminder, Mexico just should not be the best, like an example of good policy on COVID. I'm sorry, it's been objectively bad. Objectively bad. Gatel started the pandemic as kind of a national hero. Now he's been very much disgraced. People don't like him anymore. There is, the official COVID numbers are vastly underreported precisely because we have such little testing. So a lot of people were not tested and they died. There was a study that was made in May on predicting excess mortality in numerous countries, and Mexico ended up even exceeding Brazil. I should add a country with considerably larger population in terms of total COVID deaths, including estimated excess deaths. So almost 3 times the number of reported cases. Now, this might be a bit inflated. I honestly, I think it's a bit too much because Brazil really had, a COVID massacre back in the third and second waves. So I'm not quite sure that Mexico's is that high, but it is definitely much higher than the reported numbers. So again, why is Jimmy Dore picking a country with such a poor COVID record as his example of good COVID policy? And I repeat, he doesn't know the circumstances of Mexican policy. He doesn't know that the reason that the government is so stingy with those vaccines is not because they're anti-vax. I don't think that there are many anti-vaxxers in our government. In fact, the anti-vax movement in this country is not big. You don't have anti-vax protests. You don't, there's a few celebrities that are anti-vax, and they're whining about it on Instagram and Twitter. But on the whole, we don't have that huge amount of vaccine denialism that you have in the U.S. And I think part of the reason is because this is a country that a couple of generations ago was still very, very poor. Like very, very poor. I mean, Mexico's still poor-ish. It's not dirt poor as a whole anymore. But a couple of generations ago, it was. And I think the experience of people who, as older people, especially, around the boomer generation in Mexico, they probably know people who died of an infectious disease. Stuff that this generation probably doesn't have to worry about anymore because we do have widespread vaccination. Infectious diseases are no longer a big threat in Mexico as they were in the past, or as they are in poorer parts of the world like Sub-Saharan Africa. So I think that's a big reason why a lot of people in Mexico kind of are more willing to trust the vaccines than in the US. But there is also a lot of misinformation here as well. And some people do, especially less educated people, do succumb to that misinformation. But I repeat, this video was full of just a basic misunderstanding of Mexican health policy and of how Mexico dealt with the vaccine. And he just took one statement that he saw in one random online newspaper and said, I'm going to run with this. I'm going to show it as fact. And their audience, here's what's the saddest part. Look at the replies to this video. This is shocking. This is when you know that Jimmy Dore's fan base is now fully MAGA. President of Mexico has more morals and integrity than our own. Let's go, Brandon. Giving children the jab isn't going to end well. Let's go, Brandon. Mexico handling the pandemic vastly better than most countries. Really, Mike. Really. Well done. Let's go, Brandon. Let's go, Brandon. Dr. Alcocer is a renowned immunologist. Okay. Hurry up, Brandon. Let's go, Brandon. Let's go, Brandon. Leave the kids alone. Let's go, Brandon. Let's go, Brandon. Let's go, Brandon. I can't go on. Let's go, Brandon. More, let's go, Brandon. Look at this. Look at this. Tell me that Jimmy Dore is not MAGA now. It goes on and on and on. This is unbelievable. Unbelievable. I think I'm going to make a separate video just on all these Let's Go Brandon replies. But yeah, that's all I have to say. Yeah, this guy's an idiot. He's a fucking idiot. And his fan base, he gets the fan base that he deserves. A bunch of basically alt-left and far-right reactionaries that are not interested in truth, because Jimmy Dore is not committed to truth. So on that note, if you like this video, please like, please share. Most importantly, please subscribe to this channel, and I will see you next time.